Here we go with the final piece of the puzzle, which is Part D, or your prescription drug plan.
In 2005 or 2006, President Bush signed Part D into law.
Prior to this law being signed, if you were outside of a hospital setting, you were totally responsible for the cost of your prescription medication.
This is the way Part D works, and for simplicity's sake, I'm going to assume that you are taking a Part D plan without an annual deductible. And please remember what I'm going to tell you, I'm rounding the numbers up. So therefore, it's easier to explain, and at the same time, I want you to understand the concept.
Here we go. From dollar number one to $4,000, you are going to be paying copays. The copays represent 25% of the actual cost of the medication.
So if you're paying 25%, your prescription drug plan is picking up the other 75%. That equals, of course, 100%, or what they call the true retail value. Now, let's put some numbers with this. Say you're paying $5 for a prescription medication, and it's a generic medication. If you're paying $15 is being picked up by the prescription drug plan. That, of course, equals 20 in anybody's math. That is the true retail price. They use the true retail price to get you over to the donut hole. Not just the $5 that you've been paying, but the 20, the true retail price. Now, once you hit the donut hole, you are responsible for the entire cost of your medication. From $4,000 to $8,000, you're responsible for the total cost. If you come out on the other side of the donut hole, you're responsible for 5% of the cost. The prescription drug plan picks up the other 95%. Now, for most people, you are not even going to enter the donut hole. But in the event that you do, and you come through catastrophic coverage, you are responsible for 5%. The prescription drug plan picks up the other 95%. And that continues until the end of the calendar year.